Fibroids are growths that arise from the muscular wall of the uterus or womb. Fibroids are almost always benign or non-cancerous. They are rather common, especially among women in their 30s and 40s, although they can occur in women of any age. These growths can develop on the outside of the uterus, the inside, or right within the muscular wall of the uterus, and they can vary in size. Although a single fibroid can occur, multiple fibroids are often present. They may remain inactive for years at a time or grow rapidly. Often, fibroids cause no symptoms at all, so you may not know you have them until a mass or lump is found during a routine examination. But sometimes, fibroids do cause symptoms, including menstrual periods that are longer, heavier, or more frequent than usual, pain with menstrual periods, or vaginal bleeding between periods. There can be pain in the lower back or abdomen, or pain during intercourse. And fibroids can cause frequent urination if they press on the bladder. Depending on their location, fibroids can sometimes interfere with a woman's ability to become pregnant or deliver a baby. Although the causes of fibroids are not well understood, their growth may be influenced by the female hormone estrogen. Fibroids may grow when the estrogen levels are increased, as occurs with the use of some birth control pills, or during pregnancy. They can cause discomfort, grow rapidly, or rarely block the birth canal, requiring delivery by cesarean section. During menopause, when estrogen levels decrease, fibroids tend to stop growing and become smaller. Although fibroids may be suspected during a pelvic examination, further evaluation is sometimes necessary to assist in the diagnosis. For example, fibroids can be detected by ultrasound, which uses painless sound waves to see inside the body. With the procedure called laparoscopy, a special instrument can be inserted through a small incision near the belly button to look directly at the internal organs and check for the presence of fibroids. The inside cavity of the uterus can be examined with a similar instrument called a hysteroscope. Fibroids which do not cause symptoms and are not enlarging may require only periodic re-examination and no treatment at all. Treatment is usually recommended when fibroids cause excessive menstrual bleeding or pain or abnormal vaginal bleeding. Large or rapidly growing fibroids may also need treatment, as may those which could interfere with pregnancy. Some medications that temporarily shrink fibroids prior to surgery are being evaluated, and you may want to ask more about them. If surgery is necessary, then either of two procedures may be recommended. The first, called myomectomy, involves removal of just the fibroid tissue, without removing the uterus. This method is preferred for women who may wish to become pregnant someday. In some cases, a special type of myomectomy can be performed using the laparoscope or hysteroscope. Women should be aware that scarring inside or outside the uterus can occur after extensive myomectomy, and this scarring can sometimes cause menstrual abnormalities or infertility, or make it necessary to deliver future pregnancies by cesarean section. The second type of surgery for fibroids is surgical removal of the entire uterus, a procedure known as a hysterectomy. It is impossible to have children after a hysterectomy, so it's very important for women in their reproductive years to consider this treatment carefully. When necessary, myomectomy or hysterectomy for fibroids are generally very successful, but most women with fibroids need no treatment at all. Regular checkups are all that's required.